Another 50 million are underinsured. National health care solve our health insurance problem. Right? What our nation is national health
Go, John!
Come with us! March for Ohio!
I speak for my patient. I work in every city. I see a near miss. I see a wound every week. I see a death 3 or 4 times a year from lack of health insurance alone. That's what I see every day. I look into the eyes of patients who don't have health care. I don't know what the things that they need. I have to tell them, even when I That's wrong. That's wrong.
Shame on them!
That's wrong out here. Now, people might think the doctors don't care about this. My organization, Petition for National Health Program, and I sat down in 1990 starting this work after watching people get abused by these people every single day. I was part of it.
Hey,
Teaching my people care every day. They were asking me to do that as part of my job, and I said no. I'm not going to do it anymore. It's wrong.
God bless you!
I know the underbelly of this industry. They can't lie to me, and I'll make sure they don't lie to you either.
Good.
That's number one. The doctors, when I first sat down around a little tiny table, there were maybe 40 of us talking about this, and we represented maybe 800 doctors across the entire country, mostly public health types, people who knew health is a big H. It's not medical care. It means a whole society that works together to keep us healthy. It means healthy schools. It means ability to walk in a safe place. It means proper food. It means nutrition. It means prevention. It doesn't just mean you get a heart bypass. A heart bypass is a failure. That means they didn't get the care they needed early. They didn't get the cholesterol, the blood pressure, the diabetes under control. You know, that's a failure. A perfect bypass is a failure. We need to understand that. We need to work to eliminate disease and disability if we can. And that takes a whole different sort of system, not one based on profit, not one based on money, but one based on providing health care to all, everybody, every person in, nobody out. That's what we want, okay? The doctors are there now. There's 15,000 members of Physicians for National Health Program. 15,000, 400 to 15,000 in the last 15 years. That's where we're at. Not only that, we just studied the physicians across the country.
AMA members.
AMA members. The list was of all physicians, but it included AMA members, American Medical Association, long a barrier to getting everybody health care in this country. We found 2,500 doctors who filled out a survey for us across all specialties. 59% of doctors now support national health insurance. That's a 10% growth from the last time we studied it 5 years ago. The doctors are there. We're tired of looking in sick people's eyes and telling them no. We're tired of being whores for the insurance industry.
Go, John! Go like it is, John!
And it's going to stop. And this is just a little piece of how we're going to make it stop. By standing in front of these people and making them go home and think about what they're doing every day. We're making money to let people die. We live in a country where people take money to let people die. Why is war the best thing we do? Why is war the best thing we do? We can do better. We can have the best healthcare system in the world. We already spend enough money. We got the best doctors, the best hospitals, the best equipment, the best nurses, the best technicians, and the worst system in the world, in the industrial world for taking care of it. So, I'm not going to rest. You know, many years ago, when we had hope for Clinton to actually do something, I took a bus ride to Arkansas. I don't know if anybody's in this group that went on that bus ride, but we took a bus ride to tell Mr. Clinton we needed single payer. That was 1992. The disabled led a march right out of the auditorium we were in, up the streets of Little Rock, to the State House, where Clinton was helping to inaugurate his successor as governor of Arkansas. And we asked him then for single payer. And we've been working ever since. There was a man on that bus at that time who was in his 70s who worked for the Electrical Workers Union, the U.E. He'd been working on the lines since Roosevelt. Okay? He was retired. He was still on that bus looking for national health insurance.
Yeah.
So this is not just a job for today. This isn't just a job for tomorrow. It isn't a job till we win. And we'll win.
Yeah.
We'll win. Why? Because it's just. Because it represents who we really are as people. So we will win. But that won't be the end of it. There's $2 trillion at stake now, growing every day. These guys are not going to walk away from $2 trillion.
Yeah.
They never look a sick person in the eye.
Right.
They never tell a sick person no.
Right.
They never see the suffering.
Right.
So we can't be committed to this until we win. We have to be committed to a movement for the rest of our lives to get not-for-profit national health insurance that works for all of us, whose purpose is to make us the healthiest nation on earth with a big H, not just medical care.
Right.
And that's why we're here, every one of us.
Right on. I'm going to tell you a school story. Not long ago, we went to the Columbus City Schools and asked them how much money for a year were they spending for their employees to cover them for health insurance. Well, they said $65 million a year it costs for their employees. That doesn't count the amount of money that the employees were paying out in co-pays and deductibles and in part of the premium payments. When we figured what it would cost them to have health insurance under the Health Care for All Highlands Act, the total was about $16.5 million. In other words, the schools